I know this thing is on, and I know that you can hear me. Nursing and healthcare needs advocates and activism. So what are you waiting for? Let's do the damn thing. So, you rely on us every single day. And I don't mean just us by nurses, healthcare workers, nurses, physicians, social workers, anybody in the healthcare game or space. We are the people that are, supposed to save your life. But who are saving our lives? The truth is, there's actually a serious issue with addiction. It's a rising crisis that's tearing through the healthcare field. It's a crisis hidden by long shifts and professional secrecy. Again, just clouded in, stigma. People don't want to talk about the fact that nurses, physicians, allied health workers suffer from addiction as well. The numbers are stark. We know that about 10 to 15% of nurses will struggle with substance abuse. And we also know that the risk of fatal overdose is not equal across the board. Certain groups are alarmingly more vulnerable. So registered nurses are 2.2 times more likely to die from a drug overdose than a non-healthcare worker, which is crazy. I didn't even know that stat. Social and behavioral health workers face even a higher risk, 2.55 times the rate of the general public. Physician suicide rates are shockingly high, and the substance abuse is a major contributing factor. So we need to talk about it. We need to talk about those high pressure factors that are driving this situation to continue to occur, including the fact that 43% of drug related deaths in healthcare workers involve medications directly taken from the workplace. This is not a Nurse Jackie episode. This is not anything that you've seen on TV. We're talking about real people. And with today's episode, I have brought my husband from a typical podcast, Jordan, who's a social worker. Welcome, Jordan, to the show.
Yeah, it's an important topic. I don't think a lot of people are as aware of it as they should be. When you look at the workplace culture and the environment that nurses work in, doctors work in, these healthcare professionals work in, I mean, I don't think it's too surprising that, especially that kind of pull yourself up by your bootstraps mentality that seems to kind of pervade healthcare broadly, particularly those at the hospital. So I think it's really important to realize that and understand that, I mean, the problem is stigma, amongst other things. I mean, there's many root causes to this issue, but the reason why it's pervasive is because of stigma. Because if you could acknowledge that you're struggling, things wouldn't progress so far. And it impacts client safety, and it impacts the safety of colleagues, and it impacts the safety, of course, of the individual who's using substances. So I think that it's really important that we talk about this, and I think that a lot of people can take learnings from it.
I think one of the things that why this kind of bubbled to the surface, and I always wanted to do an episode talking about addiction because we have people in our lives who have faced addiction that are still struggling with addiction. And I think that even the fact that, I've probably done 6 seasons of The Grey Nurse, and I don't think I've actually had an episode talking about nurses who are addicted or healthcare workers who are addicted to substance that continue to work. And I kind of maybe wonder why that is. Like, I don't know why I haven't had an episode. I know that, to be honest, I can't think of any specific colleague that I work with in this current climate that is facing addiction, but the stats are there. Like, the stats are quite alarming, knowing that there is most likely someone that I've worked with that has faced challenges with addiction. And again, like I said, this kind of bubbled to the surface most recently with a nurse who, again, I don't know the full details. It's kind of like I'm only reading off the headline. And the headline said that, this particular nurse, they didn't actually mention her name her name is Lindsay Ward, and at 30 weeks pregnant. She's a NICU nurse practitioner, and her husband actually works at the same hospital. He's an ER nurse, and she was found dead in her vehicle in the hospital parking lot. And again, the article said that she died by overdose, but again, some people are saying, it wasn't overdose in terms of, opioids or whatever it might be, that there was another problem, that it was, mental health. And either way, I think either way you slice it, right? Whether it was that, this nurse had an addiction and died by her addiction, or this nurse had a mental health problem and died by suicide, it's both very, very, very tragic. We had 2 people lose their lives. She was pregnant, 30 weeks pregnant, and she lost her life as well. And I think that we just don't open these conversations. And it actually really brings me back. And I don't know how much you remember of this conversation that I had way back when, of my first kind of encounter about talking about someone who was, using alcohol as a way to cope within the workplace. And I should have known that this person was a fucking asshole from that conversation.
So to be clear, you're talking about the person who was talking about the person.
Yes.
Abusing substances.
Yes. So not the person abusing substances or the person that was utilizing substance to cope, but actually the person who was talking about this individual. So let me back it back up. You know, I've talked about this time and time again about this particular leader. She was a maternal child leader at an organization I used to work at. My first instance of meeting this individual, I remember, you know, I signed my hire documents, and I'm sitting in this director's office, and she's like, "Did you know what happened to the director previous to this role?" And I was like, "Nope, I can tell." And she went right in, and she's like, "Oh yeah, you know, she actually," it's like, it was like a ghost story. "Oh, she still roams the halls of this hospital." And I was like, "Okay." And she's just like, "Well, yeah, you know, you'll probably see her around here, you know." I remember I was working with her, and one day she was just drunk behind her desk. And I was like, this is kind of a fucked up story. And she's like, "Oh yeah, you know, instead of them getting rid of her, they just kind of move her around from here to there. And eventually, you know, hopefully she'll just be gone." She made this whole unit a shit show. And I was just like, to be honest, I was fucking shocked. I was just like, this is day one and this is the conversation we're having. And I was shocked in the fact that, like, I just didn't know how to respond. So I wasn't sitting there like, ha ha he he, this is whatever. I just probably was sitting there like, I don't know I don't know what this person looks like. I don't know who this individual is. I don't really care about her addictions. But this was like my introduction to someone that I've never met. So already, like, this tarnished reputation from someone who's clearly struggling. And like I said, I should have known this person was an asshole right from the hop, right from the jump, because obviously this person, no one wants to come to work drunk. No one wants to come to work that they've taken substances and be caught. Nobody's asking for that. But clearly that should be a pretty good indicator that that person needs a lot of help. If someone is coming to work intoxicated, high, whatever the case may be, that's not just like, "Oh, you know, I want to show you what the situation here is." It's literally a desperate cry. That's something it's not like they just woke up this morning and did that. That's something that's long standing. And this was my first impression of this individual, and I never met her. And I remember seeing her, I think, you know, through various subsequent meetings. I think she was moved into another department, but then later ended up, I think, leaving the organization. I'm not 100% sure, but like right off the hop, like a tarnished record. And I was just like, this is really disgusting. And again, I didn't even have the opportunity to, and I think this is where, like, I talk about like nursing charting. It was like literally that like nasty nursing charting about a patient or about an individual in this most derogatory light. So when I meet that person, I'm going to have that same interaction, having all that in the back of my mind, as opposed to having compassion.
Yep. That's just it. I mean, let's be clear, there's a lot to unpack there, but the fact of the matter is that stigma is a huge part of it. We've already talked about that. Curiosity is part of the cure to that stigma.
What do you mean by that? What do you mean curiosity?
So when you are inclined to stigmatize people, like, we all make judgments, and all those judgments are informed by non-conscious processing in our brains because we've been acculturated because of all the things, right? The cure to that can be to ask why. Don't ask the person why, but this is just introspective. Ask yourself why that person might be abusing substances, right?
I don't know if this person got that opportunity.
No. And it would be, I mean, it's not their business to find out the actual reason why. But when in your mind, this person is not doing these things because for no reason. It's not happening in a vacuum, right? And also, it's also important to ask yourself why. Why do I feel that way about that person? Why do I think it's okay to air their dirty laundry to somebody
on day one
and to bias a person who's never met them against them, right? So now they don't even get a second chance,
right?
They don't get a fresh slate until they leave, and maybe not even then, because as you've said, delivery is a small world, and word travels fast. I mean, at the end of the day, I understand there's frustration, though, right? I'm not going to try and like defend your boss too much because there's other issues here, and what the way that
my former boss,
the way that person responded,
former.
All right, well, let's not do too many. So that was kind of a canary in the coal mine moment for you too, unbeknownst to you. So maybe that's a takeaway for some folks, is that if you have a boss who's being that glib about somebody else's personal business,
while they're like already down on their luck, right?
And one part of your job, by the way, as a supervisor, is to maintain a level of confidentiality for your reports.
Like,
so
none.
Not just is there that, but there's also clearly the mental health considerations and the biopsychosocial factors that go into how that person's operating in the world. That's not happening. And so that's a problem, right? That's a problem writ large across society, but that's a big problem for somebody who's a nurse, who's presumably got their master's degree and should know better, right? And it's a sad statement of affairs that we can just look at the most essentialized version of those people. You're talking about somebody who formerly had actually risen fairly high within an organization, and now they've kind of fallen off. They've fallen off of their projected goal of either maintaining or continuing to rise. What would cause such a thing?
Yeah, I mean, we have lives, right? Like, we have lives outside of these hospital walls or whatever the case may be. And it's some of those events that cause, people to abuse to substances or whatever the case may be. It could be a divorce. It could be like a loss of a family member. There's all sorts of reasons why people fall towards addictions. And again, sorry, I didn't mean to cut you off, but it was just like, I think that people don't think about. I remember when my former co-host came on to the scene, and then she came into my office, our shared office, and was like, "Did you hear about blah 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 blah?" And I'm like, "Wow!" Like, she told you too? And she's like, "Yeah," but that's just like, that doesn't set us up for success. That doesn't set up anybody who's working in that environment. It makes it a toxic working environment for that person. Again, we're trying to reduce stigma. Again, this is why I say healthcare. It's like, we're supposed to be caring people, right? Looking after other people, ensuring that, we're putting their best foot forward, trying to heal, and actively tearing people down. Like, that is an active decision to tear someone down in that manner.
And it's very groupthinky. Right? It's very like that all the wolves after
you. But
you.
Why?
Because this person, I mean, listen, you can justify a lot in this world, right?
What you can say, she caused the budget to be inflated, or this, that, and the other.
I'm not saying that it's justifiable. I'm just saying that nevertheless, it's still being justified. Right. There's lots of horrible things that happen in the world, but the reasoning would have been like, oh well, this person puts patient safety at risk, and they let down their team, and they crap the bed, and now look at the mess I'm having to clean up and all that other crap. I mean, at the end of the day, you're still a human. You're still expected to have compassion. If somebody's life is falling apart, then to kick them while they're down and be like, well, yeah, you fucked everything up. Well, everything for you was fucked up. I mean, that's very just lacking in compassion. And that, to me, more than anything, is kind of the issue, is the lack of compassion, and the fact that it falls very much in line, unfortunately, with the whole nurses eating their young, or that concept of like bullying within nursing that is kind of not unique to nursing, but it's definitely a prevalent issue in nursing. So I think that there's lots of ways to address it, but it's sad that when it's coming from somebody in such a high position.
Yeah, again, it wasn't like this wasn't information that I needed as like a clinical educator, or as like, this information is going to help me do my job, or this information, like, no, it was absolutely should have been kept confidential and absolutely none of my business. And I think that, probably through stigma and shame, that's probably why this person ended up leaving the organization. I don't know. I don't know 100%, but if I knew people were talking about me behind my back while I was struggling, knowing I had, like, I could only imagine how mortified that individual was to be found in that type of way, where she needed help so publicly at her workplace. Like, I think that would be mortifying for anybody. That would be like one of those moments where you're just like, yeah, I need help. And to take that and to share that, like, amongst the team, I mean, I wouldn't want to continue to show my face because of how...
Sorry, but it functions like a pillory. Do you know what a pillory is?
Tell me, what's the word of the day?
Pillory. So a pillory is when you, like in the public square, they used to put those
Oh
things
yes,
over your
okay,
head, and
yes,
you'd be
yes,
kind of
yes,
locked
yes,
in there, and it'd be
yes.
like this public shaming, and then people could walk by and like scold you and throw things at you and
Right.
stuff like that. Maybe even hit you a few times. So it's very much like that. But what is the point of a pillory? The point of a pillory isn't
It's to
just
cause pain
it's to cause pain
and
but
suffering.
what's the point societally? It's to teach everybody else
that if this happens to you,
that if you do
or
this,
you do
this
this,
is what's going to
gonna
happen to you. So what's the
It's
broader
disgusting.
message that they're reinforcing that stigma? If you were
That's so
of
up.
all the nurses and all the people in the hospital, anybody who knew, which sounds like pretty much everybody,
No, like everybody.
what are
knew,
they going
yeah.
to do when they feel like they're having issues? Like, and by the way, the slide into addictions can be very subtle, right? What happens when, say, a nurse hypothetically falls, hurts their hip because a patient knocked them over? Well, now, or they slipped in like a fluid and they hurt themselves and they got on pain meds, and then they
Yep.
realize that those pain medications make them feel less anxious.
Right.
Right. And they can get through shifts without being debilitated by their anxiety. What do? Or they realize they're anxious and they're like, well, I'm really having a hard time getting to work. I should go tell somebody. I'd like to, but there's no way I'm going to, because look at what happened to that woman over there.
Yeah, geez.
Right.
It makes me think, just like through having this conversation with you, it's like healthcare is I mean, the stats are there that healthcare is a ripe environment for this to occur, because not just because of the availability of medications and different things like that, but because of how toxic and awful we treat each other. Yeah. That in itself creates this really toxic environment where you're just like, if I need to cope in silence. I can't let other people know what's really happening with me, because like you said, I'll be like, that is the pillory that will happen. Oh gosh. Anyways, before we get into barriers and talking about all of that, I want to just talk a little bit about stats. And again, this is where Canada has an issue. And I'm speaking to you leaders who have the availability. And again, because we've created so much stigma around this, people probably won't come forward. But I think it'd be important for us to actually have an understanding of knowing who this is happening to and how we can best support. But Canada does not keep stats. So I'll be reading American stats. Healthcare support workers, home health aides were 1.6 times more likely to die of a drug overdose. Physicians, including psychiatrists, health technicians, and other treating and diagnostic healthcare workers, did not show an increased risk of overdose death in this particular study that I'm talking about. But opioids were also heavily involved, with approximately 84.5% of drug overdose deaths among all healthcare workers were actually opioid related. It's wild, right? And I think that, again, I'd say the most concerning part about this is how we talk about opioids, particularly in recent news, right? We have the fentanyl czar. There's all this talk about like opioids crossing the border and how like opioids are bad. It's like, okay, I think the language around it matters. And I don't think the apples are the same. Of course, I think that we have to have these conversations. And I think just in light of, some of the things that we're seeing, it makes it more difficult to come forward to say that, maybe I'm struggling with opioid use because of the way that it's been talked about in the last, couple months.
And there's this whole concept in medicine, at least I've seen it anecdotally, and I'm sure you could speak to it more broadly. But there's this whole concept that you kind of have to hoist yourself on your own to when you're a nurse, like so when you're not feeling well, if you're feeling overwhelmed, if you're feeling stressed, you got to go in because you don't want to affect the staffing ratios,
right?
You don't want to short shift your colleagues or whatever, right? Or if you're a doctor, it's like, well, I'm the only one who can go in. There's literally no other pediatricians in rotation. I got to go in, just regardless of how I feel, right? Or if you're same goes if you're a social worker at a hospital or whatever, right? Like, I got to get in there. I got clients who are waiting for me. I can't have them reschedule. Imagine that's going to create a backlog, blah, 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 blah. And the whole concept around taking a mental health day is still relative. Like, I think people are like, I'm sick with a virus or a bacterial infection, or I'm injured. Those are like tier 1 legit. And then tier 2 is a distant second. I need a day off because I'm stressed, right? And let's be clear, one day off, if you're feeling chronically stressed, is probably not going to be enough, but it's better than zero.
Yeah. Well, people still feel like very apprehensive to take mental health days. And again, I'm telling you, you do not have to tell your workplace, why you're taking the day off. It's none of their business.
You can literally just say, I'm not feeling it. That covers.
But you aren't feeling well.
Exactly.
Like,
it covers,
seriously.
That covers everything. That could not be feeling well, including I'm feeling under the weather, I hurt my leg. And the less specific you are, the better it is, to be perfectly frank. And if you have a very supportive boss, it's your business.
Yeah.
Right?
And it's so shameful that we have to be like, you don't have to give them this information, because again, until workplaces really prove themselves to be safe spaces, and again, the conversation's starting to happen more where people are talking about mental health days and using them as a form of sick days or whatever the case may be. I think at the end of the day, like I said, you don't have to explain anything to anybody. You take the day if you need it.
So this is all in an effort to prevent the circumstances that can lead to addictions. But once you have an addiction, there's many different complicating factors involved in terms of like, okay, well, this coping mechanism, which is really what an addiction is. An addiction is your attempt to manage the pain that your brain is experiencing vis-a-vis anxiety, depression, whatever. And so the addiction is there to work as a salve against that unremitting pain in some cases, right? So how do we approach that in a way that's effective? And so the current way it works right now is complete nonsense.
Oh God. Like, do we want to talk about what the current climate is?
Well, for a nurse, I mean, it's not just like if you're working at a bank. I mean, it's bad enough. And by the way, there's case history around that too with TD. But at a bank where it came out that employers do have the responsibility to kind of help you out if you have an addictions issue. It just seems to have not worked its way into. I mean, it's hard enough in that circumstance, let alone doing it in a hospital. For some reason, it's worse.
Well, I mean, have you had any experiences within your workplace or workplaces where you see programs for folks who might be, suffering with addictions? Like, have you seen anything?
They're not widely advertised, but they're often there.
That's a part of the stigma. Like, why aren't they advertised? Like, and again, I'm going to say this, like, I think people categorize in their minds what is more acceptable versus others. It's like, oh, well, it's just alcohol. It's not as bad as taking an opioid. Like, a drug is a drug is a drug. And of course, there are some more severities with, 100%. Like opioids, if they're laced with fentanyl and different things. But at the end of the day, there's not like, oh, this is a better one to take versus the other. You know what I mean? I think at the end of the day, if you're struggling with addiction, you're struggling with addiction.
Yeah, for sure. I mean, the reason why there's an addiction is in part the impairing component of it, right? Like that's the part really that needs to be addressed. In addition to the addiction, right? Is like why you have one.
Yeah.
And it sounds so simple, and it is so not, based on like recidivism rates and everything like that, and just the hell that people who have addictions go through. But at the end of the day, it is conceptually simple that there is underlying issues, mental health and otherwise, that need to be addressed. Sometimes those are external factors. Like you're going through divorce. There's only so much you can do about that. And that's leading to mental health struggles. And there's internal struggles. And sometimes those two can co-occur. You have external and internal. But at the end of the day, it's a huge challenge. And what people need in that state is support, right? The cure for addiction is connection and purpose and meaning. The opposite is kind of what's happening now, which is this stigma against it and this fear and we got to hide it, and trauma and anger and shame and all these other things that drive addiction are like mushrooms. They grow best in the dark. I think I've used that analogy before. So all we're doing by having bosses who talk crap about people who are having mental health struggles and have subsequent addictions is we're just encouraging people implicitly and somewhat explicitly to vary it.
Yeah, I would say, and I'm going to play the devil's advocate a little bit here. So I'm the employer, right? What is my bottom line? My bottom line really should be to make sure that I have happy customers, but also happy workers, because happy workers equals like more productivity, better outcomes, better, like all of these great things. I'll stick specific to healthcare because again, if you have nurses that are happy, that are thriving, that feel that they're in a good place, that are excited to come into work, I tell you, the patients know it. Like the way that like the evidence shows that the outcomes are better versus a workplace where you don't want to go into. The environment's toxic. The people are catty. The management sucks. Your directors are garbage. They're never there. Again, I think it speaks to the business of work. But like I said, playing a devil's advocate, healthcare is tricky. And I'd say in the States, it's probably even worse. So, right? Where we want productivity. We say we want best patient outcomes, but we don't treat our employers like they're people. They're machines. We want them to, and I think, and I've seen it time and time again, the hospital's bottom line is like, did we meet the budget? I've had decided meetings where they're just like, oh, well, we're not meeting the budget, so we're going to cut nurses or we're going to cut this. It's like, what is the actual bottom line here? And I would hazard to say that a lot of people would say that it's the business.
There's many problems we get into about corporate culture, but it's so often because it only operates within 1 year, 1 to 5 year. That's the length of the vision for most corporations, right? It really can result in people tripping over dollars to pick up pennies, right? It's like, no, we got to hit the bottom line by fiscal year end this year. But it's like, okay, but if you don't treat your people well, if you don't spend the money up front, like invest in a 10-year plan that's going to result in your workers feeling supported, like you have their back, then there are going to be all of these hidden costs, right?
Yeah. Well, and these are the hidden costs.
And when I did my HR degree, there was so much of what was involved.
What? Hold on. What was that? Did you say that you did an HR degree?
I have more degrees than a friggin'
thing.
Okay. So when I did HR, I was very indecisive. When I did HR, pretty much one of the main things that you do in HR is you try to write proposals to convince executives about the costs of these hidden issues that go on in organizations. Like, if you don't invest in your staff's wellness by promoting wellness, it increases sick days by X amount. Right. So everything has to relate back to the bottom line. Same thing. Like, so you do have to speak their language, and that just makes things take longer. But listen, nothing in this life is free, even especially in a hospital. I get why you have to come up with these cases, but by now it is borne out by myriad papers. It's just these CEOs are now choosing to a certain degree to not take them seriously. It is important to invest in your employees' health. It is important to invest in their safety. It is important to invest in their mental health and wellness, because those do hit your bottom line. It's not exactly 100% clear. So they're like, really, I don't realize that gain, or I won't realize that gain for 10 years. And I'm thinking of the next 5. That's how long I write a business plan. So it's just this myopic approach is very problematic, right? And it's this willful ignorance of like, listen, like, I don't care. Not even ignorance, I guess. It's just like apathy.
Like, I was thinking about myself and just like, I've been a nurse for over 10 plus years. And I was like, okay, so how many do I know of any particular special programs? And I think I only heard of it through the grapevine that, for example, and this is actually only if you're union, like, I don't know if there's anything else out there that exists, but I remember hearing that like you could be put on kind of like a behavioral plan, where they kind of like watch and monitor your practice through like with the College of Nurses of Ontario, as well as, your union, where they put you on kind of like a plan to help support this worker. But again, from the person that I heard from, they said they did not feel supported and they felt it was more punitive. And this is where I'm like, we don't have the right things in place yet. And again, I scoured ChatGPT to find out like what is there out there. And man, it gave me the basics. It's like many healthcare organizations offer EAPs. Well, we know how far that's going to get you. It's not going to get you far. And then they said in-house mental health support. And I was like, okay, so yeah, there are clinicians that are available in-house, but it's like, what are you going to go on your shift? Like, I'm just kind of like, again, I wouldn't want to go to the place that I work for support. Anyways, that's just me. But again, there are some places that offer in-house support. And then again, it recommended that there are mental health toolkit and resources. If you were someone suffering from addiction and you were at like a low point, I'm glad that the resources there. They have to be there. But these aren't really in the places where I need them best. You know what I mean? Like, it's like, to me, I'm just like, something seems like it's missing here. Like, when I'm hired, maybe I'm wrong. I should know where to access resources if I have issues with addictions. I should know. But I don't think that's something that they talk about. Again, I would even bring it back further, like in nursing school. I don't remember them ever talking about what would happen if a nurse was to get addicted. Because it's just like, again, one of those, we don't talk about Bruno. We're not talking about that. We'll talk about patients and addictions, but we won't talk about, the fact that this job in itself, based on the patients, the families, the experiences, the trauma that you see, can cause you to have an addiction. I never heard a word uttered in my profession or in my upbringing or up teaching, I should say, in my teaching, that addiction could be something that comes with the job.
No, it's who the hell would want to do that job?
Well, hey, I mean, did you see what it said about behavioral support workers? 2.55.
And being one, I could definitely see why that would be the case. You talking about
see some dark shit.
Vicarious trauma, 100%, and just straight up trauma, right? And they're both very difficult to manage. So we can get into vicarious trauma at another time. But at the end of the day, it's really on the employer to support the employee as long as the employee is willing to do the things that they need to do. Like, there is a safety implication for sure, and a business has to still run, but it can't happen at the expense of your workers. We don't live in that kind of society. So if the employee is found to be using or abusing substances in an addictive way that would be considered an addiction, then they should be able to, as long as they're doing a rehabilitation program and receiving assistance to try and figure that out, then that should be treated like any other disease process.
Thank you for saying that. Like, I think that's like the humanistic version of how things should go. But again, there are so many barriers, right? There are barriers like we already talked about, stigma and shame. 100%. I would say that's probably the biggest barrier, the fact that we feel that there's going to be judgment passed on us about what's happening in our lives from colleagues, friends, and as healthcare workers, just seeing it as like a moral failing, like, I'm supposed to be out there helping others and I can't. And we take that so hard on the chest. And I think that's because how we're taught in school that we're supposed to be these like pillars of strength, but not realizing that we're still people too, right? I think that also what prolongs the fact of us actually reaching out for help, because we're like trying to continue to swim above water because we're like, we got it. But things are happening and it's so bad that we're actually drowning. And, that's when, some of the worst things can happen. An overdose, an accident, coming to work intoxicated, or whatever the case may be. And it should never get to that point.
It's important for people to know too that I don't know everything about addiction. It's not my area of specialty. And a lot of folks OD because they've used, and then they stop because they don't want to be using. And then after a period of time, because of an inflection point in their life, they jump back on again, and then they choose a dose that they did previously, but now their body is down-regulated, has re-regulated, so that is now a dose that could kill them. Right. And it's just we know accident, right? Yeah. And so that's tragic. It's tragic that they didn't have the support. It's also tragic for a variety of reasons, right? And I think that more support is needed. I think if we're looking back at healthcare more specifically, that $20 over 10 sessions for psychological assistance is not sufficient. Right. You're not incentivizing the right thing. like there's only so much help you can get from an EAP because there's limitations both in scope and skill set for the people who work at the EAP, but also in their ability to diagnose things formally, which really is where the rubber meets the road with hospital administration. If a social worker writes you a note saying, yes, this person's suffering from major depression and anxiety issues, we're actually literally not even allowed to write those notes.
But why not cut out the middleman? Get rid of EAP programs and strengthen, your mental health support program where it's like, okay, we will give you these funds for you to choose a person of your choice, you're choosing to get the support. Because I think the EAP is cheap.
Well, and here's the thing. So let's be clear. Nurses and frontline staff at hospitals and mental health workers and doctors, I would say, face comparable levels of stress to police officers and first responders. When I was with a victim services organization, they had, I think it was like $10,000 a year or something like that.
And some of that shit's mandatory. Sometimes they have to something tragic or something really bad happens. 100%. And it's like, you are mandated to go do like these sessions. You have to do it.
It wasn't even just after an incident. I'm so glad
that you mentioned that.
It wasn't even just after an incident. It was actually like mandated, like you had to check in regardless of what happened.
Nursing should have that.
100%.
Healthcare should have that. Like, you seen a tragic birth. That patient died. That person was a gunshot wound and you were holding the wound closed, or, you saw a baby die. You are mandated to come in to do 5 sessions with us. Or even if you didn't have a tragic incident, you have to do your 2 check-ins a year.
Right.
Why don't we do that?
Well, listen, that's just should be the minimum, because at least what that shows nurses and doctors and frontline healthcare workers is that you care the bare minimum, right? That opens the door a little bit, because who knows, during those mandated psychology sessions, right? Assessments, it might be disclosed. Yeah, I'm struggling. I think I'm starting to drink too much wine. Like, I think I hit too many beers, or like my pain meds. I don't really feel pain in that leg anymore, but I've been telling my doctor I do, right? And then we can catch these things earlier, so that maybe the addiction doesn't become so entrenched. Maybe we can get some more supports in play. But that at least shows, like, if listen, don't watch the mouth, watch the hands. So you can say, you can send out all the memos you want in the world. You can send out all the psychoeducational documents and say, listen, we have all of this wonderful stuff on the shared drive on SharePoint. It doesn't matter, because as an employee, what I watch is what you do and where you place the emphasis of your funding and your energy. If you place a lot of it in a
good pilot program,
if you put a lot of emphasis on my mental health, hey, I'm more likely to be like, oh yeah, these people actually take this shit seriously. I worked at an organization recently, and it had its pros and its cons, but one of the things I was of no doubt on was that they took that seriously.
Right? Yeah.
Right? Why? Well, in part because when the CEO sent out her message, in her signature, it went out all the time. It was like, I do not expect you, and I do not want you to answer any emails or take phone calls after your shift is done.
Right.
Right. To me, I was like, okay. And it was a for real thing.
Yeah. And I think that would be actually, like I said, I think that'd be an amazing pilot program for someone to run, to say, hey, let me just give this a try. And I know some people, of course, anybody can make a workaround to anything. Because some people are like, oh, well, police officers are so, yes, okay, yeah, we know that, right? But I think the other reason is because they have deadly weapons, they have firearms or whatever. You don't want crazy police officers shooting people. Anyways, that's a whole other conversation. But again,
even the clerical staff had to do it.
Well, see, then there's really no excuse. I was going to say, healthcare workers, we deal with people's lives on a daily basis. So you should want to make sure that
what the pilot project should be is nurses, everything that the police have in terms of.
Well, why don't nurses have the same benefits police officers do? We don't get the same pay. We don't get the same protection for mental health supports. We aren't under presumptive care models. We don't have strong unions that, I
could only speculate, and I don't want to piss off anybody.
Tell me what it is, Jordan. Is it because
your union sucks?
Is it because
your union sucks?
Is it because
you're women?
Yeah, that's exactly what it is. Our unions suck. Not all the unions suck, but some suck. But yeah, like, I think this is where we need to be not just taken more seriously, but like demanding the fact that look at these other professions and what they get in relation. The evidence speaks for itself. Like the CFNU has been like, we face more burnout, more challenges to that, similar to police officers and firefighters, higher than police officers and firefighters. So why don't we have some of the same measures put in place? Our unions have to do some work. But again, just backing it up again, just talking quickly about the barriers, like again, that there's always fear of, losing your job or your license. I've heard that time and time again. Like I could just show you the stories I received from other nurses saying like, the main thing is they're like, we just don't want to lose our license. We have to work. We need income. And if I disclose that I'm addicted to whatever the case may be, I'm going to lose my job. And again, that's a concern. If people don't feel that they can come forward because they're going to lose their work, then we have people that are addicted and not getting support. Again, there's that issue related to financial burdens, confidentiality concerns, thanks to that person that my first job on, they blurted out this person's business. And then again, it's no shock that this is considered a barrier where people don't feel that their information, if they share it, will be held in confidence, right? And again, I think, we've kind of touched on the lack of awareness just in general. Like I'm saying, like, I don't know. I've worked for a nurse for, over almost 15 years now. And I'm like, okay, I don't know about the programs. I don't know anything at the ground level. And again, just workplace culture, high stress. It's just like the environment is just right for it, right? High stress environment, fast paced. We work hard. I wouldn't even say we play hard. Like we work hard. Hierarchical, all of these different things that kind of create that ripe environment for, substance abuse or substance use, I should say, to actually occur. Access. Right. And having that availability and access. And again, I bet you that in relation to supportive return to work programs, I mean, they were still asking me how much I can lift when I was having my challenges with mental health. So what is the solution, right? Like we talked about the challenges, the barriers, the fact that, we're not being treated in the same manner, but like, what are we asking for? What do we need to see? What do you think?
I think nurses need to stand up and demand at least.
Our legs are tired. I guess you didn't expect me to say that.
Put your Birkenstocks on.
My legs are tired.
Put your Birkenstocks on. Stand your asses up and demand more.
Yeah,
police and firemen freaking, like, you don't hear them pussyfooting around. Yeah. Like, when they want something, they get it. If they want $10,000 worth of benefits for mental health related issues, they get it. In fact, some of them don't even want it and they get it. Because it needs to be there. It needs to be accessible, because if you get that moment where you're like, I think I do need help, you're not sitting there looking in your pocket and seeing a moth fly out going, oh, well, that's not really a priority for me financially right now. There's no excuse for a police officer to not go get therapy. You're just like, well, I got 10 grand just sitting over here not doing anything. I might as well go and try it out.
So
removing barriers, increasing, and putting your money where your friggin' mouth is.
Yeah.
Right. And also, like, from the executive down, training your folks on the importance of mental health and healthcare and what their priorities need to be on the ground level. If your employee comes to you and says, listen, I'm burnt out, and you have to take that seriously.
Yeah, I'm sorry, folks. You're going to get mad at me. But one of the things that I've noticed about healthcare is we are so reactionary. Like everything is 100%. Like some shit happens and we're like, oh, we got to fix it now. It's like we don't talk about prevention nearly enough. We are so focused on treatment. And I'm not trying to awaken some of those other people. But like, I agree. We are getting into a situation where like everything's treatment. We're going to treat you. You're going to treat. It's like, well, what are some of the things that we can do to like prevent? Like, what are the upstream approaches to saying, okay, we know that this is an issue. We know that folks face this. So what can we do to prevent it? Right? What are some of those things that we could put in place to support workers who might be doing this? Like we need to kind of, pull out that stuff like right from the hop, right at the beginning of when you're employed, to know that here are the various forms of access, or, like making us feel that if we're struggling, we can reach out for help, right?
Maybe stop stringing people along on contract and part-time work too, so they can actually access the 2 pennies that you give them for mental health resources.
Indeed. And I think, again, like, you're right. I mean, I was making the joke about our legs being tired. Put your TENS on and fucking do something, because we will get left behind, right? We're constantly being left behind. I've never seen, and physicians do a better job too, right? So police officers, they go to their unions, well, we want this percent wage increase. No one sits there and says they're being greedy. Well, I mean, they're being fucking greedy, but like nobody sits there and is like, oh, the general public doesn't sit there and say that they're greedy or whatever the case may be. They don't say it's asking too much. Or if they put a stipulation for mental health support, they're not seen as asking too much. We don't ask enough. We don't ask enough for these resources. Like we need to be like, we need to care about ourselves and we need to make other people care about ourselves. And again, one of the biggest issues that we have is we have no strike and no lockout clauses. And I think those things need to be revisited. I'm not trying to stir the pot. Maybe I am trying to stir the pot, but again, we have no bargaining power. Like we have no
I
chips.
can tell you what your chips are because police also have the same restrictions. They cannot strike. They cannot.
Yeah, they.
You know what their bargaining power is?
What's the bargaining power?
That if their union says don't vote for this party for this election, then all of them won't vote for that party in that election. And sometimes when they're that close, they are the deciding factor or a huge deciding factor. They vote.
Okay, so
there are 26,700 police officers in Ontario and 190,900 nurses.
Right.
If you vote as a block and say, listen, if we don't get X, we will not vote for you. You will not have our endorsement. That carries weight.
Well, I see we can't be political, but police officers were tweeting all sorts of crazy shit. We're being super, super political.
Listen,
so I don't understand.
Police officers are very political.
Well, I don't understand why we can't be political too. We need to put our best interests forward. And I think this is where, again, we shoot ourselves in the foot because we don't want to rock the boat here, or we don't want to make this political leader here mad because, they funded our gala or fundraiser. It's like, okay, whose interests do we have? Our own interests or other people's interests? We need to talk about solidarity in nursing. Like, we just don't fucking get it yet. Like, it's just like policing, firefighters, I'd say even paramedics. They have this whole, like, we got each other's back. It's like crickets out here.
Yeah.
I've always said this. If nurses...
teachers have their shit way more together than
yeah, man. That's why they can get shit done. But it's just like, we have a solidarity problem. We have a problem where we feel that we can't ask because we don't want to seem like we're being pushy. We don't want to seem like we're asking too much. Oh, the public might think we're greedy. We need to stop that. We're not greedy. We want fair, honest wages. We want to make sure that we're kept safe and protected from violence. And we want to ensure that we can take care of you people. Like, we want to be able to take care of people, but we need to be able to take care of ourselves.
Let me remind you, nurses, of one very important fact. Every year we hear about the police budget going up and up and up, and everybody bitches and complains for 2 weeks. And then after 2 weeks, guess what you hear?
Radio silence.
Because nobody cares after 2 weeks. 2 weeks is a overestimate, right? Because they'll complain and then they'll just pay the bill.
Yeah.
Right. And so you have to have the same strategic mentality. I'm not saying it's easy. I'm just saying that if you care about something, you'll make the time and you'll put in the effort. And this is something that's so critical to you because you make up more than quadruple the number of police officers in the province.
Could you imagine if we got our shit together? Could you imagine the bargaining power that nurses could have across the province, across Canada? Because again, we outnumber physicians, we outnumber allied healthcare workers, we outnumber teachers. Could you imagine if we could get our shit together? Can we get our shit together for our own mental health? Like, that's the question, right? So, more generally, we talked about the findings. They're drawing the importance to talking about and linking that there's evidence that shows that working in healthcare, there is not just a correlation in causation, but there is higher risk that you might be suffering with addiction or struggling with substance abuse issues. What we need as a healthcare society and collective...
Another LMS module. Oh, wait, sorry. That's not what you need.
What we need is confidential, effective treatment, upstream approaches where we're not just solely focused on treatment, but identifying the issues. And then also, we got to pull up them 10s, spend an extra hour out there and being like, those guys got it. our stats are worse, here's why the public needs to know why we need to get it too. Because I think if we get buying power from the public saying, hey, we need to support nurses, and that nurses start showing up because, we also have to show up, that maybe we can shift the zeitgeist.
I mean, that's wonderful, and be great if the public came on your side. But as anybody in kind of industrial relations knows, like, public opinion ebbs and flows depending on whether or not they get what they want or not. Teachers know this because if they strike, they tend to strike at times when it's least opportune for parents, but that's so that they get the attention of parents. Nurses can't strike, but what they should do, like, I'm no strategist,
hold on, I'm going to correct you.
Election.
Cannot strike here in Ontario because of our collective agreement. But things can change, and I think things should change.
But listen, in the immediate, without that changing, because it hasn't changed for a long time.
Stop being a realist.
That's what it's called. It's important to know that you, as a bloc, represent a huge force in our politics in Ontario, and I think nurses need to really realize how much power they have.
Right.
Like, I've seen flight attendants and like a lockout of the United States. Right, this was years ago.
The flight attendants were striking just recently, and they had to. Yeah. They came to the table pretty quick.
But when you can't strike, you can say, "Listen," or imply, "I don't care." You think that the police commissioner and the unions go to Doug Ford or whomever, and they're like, "We're apolitical, so you just do you." And we'll negotiate completely. They go inside offices, they meet each other at the bar, and they're like, "Listen, dude, we will vote as a block against you, or we just won't show up if you don't give us X, Y, or Z."
Well, that's why we know Doug Ford's back's hurting so bad.
Nurses need to have the same backbone, speaking of backs, and have the same tough conversations where they're like, "Listen, we're apolitical, but we also have to have our own backs."
Yeah.
And so if you don't support nurses, if you're not pro-nurse, then you are not going to get 200,000 votes in this election, which might very well be enough to turn the tide against you. Maybe we won't vote for you or against you. Maybe we just won't vote, right?
Yeah, man. That's some dreamy thinking.
That's less dreamy than the issue to change a collective agreement.
What we need is solidarity. And it's an identified problem. So we've got some work to do. We don't want to lose any more nurses or any healthcare professionals to addictions. Let's do ourselves a service and start talking about it more and start demanding more. I think you're 100% right. So thank you so much for listening to the Gritty Nurse podcast. My name is Amie Archibald-Varley. I'm the Gritty Nurse. Stay tuned next week, where I don't know what we'll be talking about because, it is October. So I'm getting ready for my Halloween episode. But yeah. Yes, Jordan will do the voices. Again, thank you and stay tuned. Looking for a great gift for a nurse or someone who needs to learn about nursing? Check out my national best-selling book, The Wisdom of Nurses, Stories of Grit from the Bedside. Thank you so much for listening to The Gritty Nurse with Amie Archibald-Varley. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit the subscribe button so you'll never miss out on any awesome episodes from The Gritty Nurse. Thank you so much and stay tuned until next time. Stay gritty.